Patients come to us for cosmetic consultations. We're as close to a specialty in cosmetic dentistry as you can get in the dental industry because there is no specialty in cosmetic dentistry. Not many patients realize that there's no specialty in cosmetic dentistry, and any dentist on the whole planet can say they do cosmetic dentistry without actually having any more education in cosmetic dentistry that would make them more suitable for you to do something like porcelain veneers. So you are left to do your own research. But that's a little bit off topic. What I really wanted to talk about is the patients that coming to us frequently have a lot of chipping and tooth wear on their teeth, and that's one of the reasons why they really want to improve their smiles. And it's really gotten to the point where it's affecting their self-confidence, and when they smile, their teeth look older, their smile looks older, it makes your whole face look older. And one of the most amazing things that we can do is provide people with a dental facelift. That's what it's called in the industry, a dental facelift. And so when you get your smile improved, because your smile looks so much younger, it increases the look of the lower third of the face and makes it more attractive, and it makes the whole smile, whole face look more youthful, which is totally amazing as a side benefit to getting your smile improved. But because people are coming to us with chipping and wear, and it's gotten to be such an extreme point that it's affected their self-confidence, what I wanted to talk about is how we can mitigate the damage that's done to our teeth throughout our lives to make sure we actually never get to the point where we're spending a ton of money to restore our teeth and smiles using things like porcelain veneers. So what you should be doing is actually looking at your teeth in the mirror, or put your phone in selfie mode, or whatever you have to do if you don't have a mirror near you, and looking at your teeth, because healthy teeth shouldn't actually have any chips in them. Now I know, like, if you ever got hit in the mouth with something like a bat or a ball, or you chipped your tooth on like a bottle or a fork, like, I get it. You'll have a chip on your tooth. But if you don't recall ever hitting your teeth with anything that would be hard enough to chip them, and you're looking in the mirror right now and you see little chips on the edges of your teeth, that's actually a sign that there's something wrong with your bite and the system is failing you. Another thing to look for is look for tooth wear, especially on the lower front teeth. Down here, like, look close in the mirror and look at the lower bottom teeth. The teeth should look like completely whole. You should see enamel all the way up to the edge. But if you're looking at your lower teeth at the very edges of the biting surfaces of your teeth, that's called the incisal edges. If you see a little strip in the middle that's darker than the outside, that's called dentin. And you should not be able to see the dentin on the edges of your lower incisor teeth. If you're seeing dentin, that means that you've worn at least 1.5 millimeters of enamel off the edges of your teeth. If you've done that, that's a lot of tooth wear. Physiology and the way that teeth wear down throughout entire lives, in a healthy system, a healthy mouth, you would typically see about 1 millimeter of enamel wear off somebody's tooth in about 100 years. So if you're showing your dentin, that's about 1.5 millimeters, so already you've worn off enough enamel to be 150 years old. So you've already really aged your teeth. And if you're looking at your teeth and you're like in your 20s or 30s or even 40s or 50s, that is too much wear for you to have at this age. But it didn't have to be like that. And so when patients come to me, it's already worn down. So there are ways to adjust the teeth and bite so that the teeth don't keep wearing down. So at this point, if you go and talk to your dentist about it, it's a good time to say, hey, I don't like what's happening with my teeth. I don't want my teeth down the road in another 20, 30 years to look this much worse, because my teeth look okay now. I'm okay with my smile, but in 20, 30 years, or even 10 years, I may not like my teeth anymore, and that may cost me a lot of money to fix it. So bring that up with your dentist and say, hey, I don't want this to happen anymore. They should be able to devise a plan for you to be able to make your bite healthier, find the cause, and then make your bite healthier. And one solution could be a night guard, but it's not the only solution. And a lot of dentists just want to throw a night guard at the problem. They say, here, wear this night guard every night. That should do it for you. However, not that many people are actually grinding and bruxing their teeth at night. Okay, that's a brain-mediated thing that some people do have. And no matter what we do with your teeth and bite during the day, you're still going to grind your teeth at night. But a lot of people, their teeth don't come together in a healthy way, and that causes them to wear down in funny places, especially in the front where you'll notice it. So what we can do actually is go ahead and put your teeth on a chewing simulator. It's something like this right here. It's actually called an articulator in the industry, but we'll call it a chewing simulator. We're going to put your teeth on a chewing simulator, and we're going to make sure we record your bite properly. Now, if your teeth are chipping and wearing down, your teeth probably aren't coming together properly right now because there's something wrong in the system. So what we would do is take a bite without your teeth touching. And it sounds crazy. How could you take a bite record a bite without your teeth touching. But we can actually do that and make sure that your joint or temporomandibular joint is in its most anatomically correct position before you take the bite. That's the best place for your joint, for your muscles, and for your teeth. And then with that bite, we put your teeth on the chewing simulator, and we can figure out which teeth are touching, because they all should be touching at the same time with the joint in the right spot. And typically, when somebody's wearing down their teeth, they're not doing that. Okay, so then we can make the adjustments, just fine adjustments to all the teeth to make sure all the teeth touch at the right time. Simultaneous bilateral contact of equal intensity with the joint in the right spot, and that'll prevent you from wearing down your teeth more in the future. And then if you had a couple chips, we can go ahead and fix those things. We can whiten your teeth, fix those chips, and make your teeth look perfect, because once we fix your bite, you won't continue to get these chips anymore. So that is just a little educational content for you on how to prevent major dentistry being done in the future, and recognizing yourself that you could have a bite problem with chipping and wear, and make sure you bring that up to your dentist and get a good solution so that you don't need expensive dentistry in the future.